Healthcare is moving from a paper-based analog system to a digital connected framework. And not only is it changing from the way that care is delivered and information is managed, it's changing the way it gets reimbursed. Today, primarily care gets reimbursed based on activity. We're headed towards fixed payments and bundled payments for episodes of care. We're moving towards an accountable care structure where you will work with everybody in your enterprise, within your supply chain, physicians working with hospitals, working with regional health information exchanges. Information has to move freely in healthcare, but it also has to be protected. And that's where Harris comes in. We're connecting information from the sources where it's created and not replicating the information, but just moving it securely to where it's needed and organizing it according to workflow. We're making it possible for people to know where their costs are by better information management. Things like business intelligence, where we can compare care delivery, the quality of care, the cost of care against a very large academic community in the United States. And you could benchmark all the way to the physician. We have dashboards that we create from the physician level all the way to the CEO of a clinical enterprise where they could know exactly where they rank in the United States in terms of care, in terms of cost, in terms of quality, and help transform it. When you look at some of the largest challenges in healthcare, you tend to think of very complicated solutions. If you can't connect the infrastructure or manage it efficiently, you can't move the information and you can't protect the information. What Harris does is we're able to come into an enterprise, lower the cost by as much as 20% typically, and deliver higher reliability in their infrastructure. A typical hospital, a large clinical enterprise, gets 50,000 phone calls a day. Well, what happens if the network goes down? People don't have access to care. You don't think about your phone system as being absolutely critical. Well, Harris, for the FAA and other very large national enterprises, we deliver global voice and voicemail as a service. We're bringing that to healthcare and helping to transform enterprises so they can deliver better care and have high reliability. So patients have access to care when they need it, not when it's just available. And it's never impeded by the network. We're moving images. 1/3 of all the data stored on the planet are medical images. How do we use that information? It's one thing to store it, but can we turn it so we can deliver better care? Can we learn from those images? So if somebody comes in with a particular case, we could then scan 1,000 of those similar images and say, you know, here's what we did based on what we saw with the previous patients, and here were the outcomes. We're doing it with Johns Hopkins, we're doing it with Kaiser Permanente, we're doing it with the Department of Veterans Affairs, we're doing it with the Cleveland Clinic and 1,000 other hospitals across the globe.